You may have heard about medical tourism. What we are doing is not anything related to the consumer, but more of a business-to-business system, an ecosystem that provides multiple options for the patients who are considering overseas treatment. In the interest of time, I'm going to go quickly. Please catch me afterwards. But essentially, medical tourism involves people who cannot, for whatever reason, get or afford medical treatment here and are going overseas to get their treatment. Their options, if they don't have that, have historically been either spend their life savings or get no treatment at all. And this is a way. What you may not know is that the extent of medical tourism, that more than 500,000 Americans traveled last year, and the significance of it. Now, a little bit about our company. I left Intel about 16 months ago and really did a lot of homework to find out something that's meaningful, something that's important, something that's relevant, and we refined it over several ideas. And I've been doing this full time. There's no other day job, and this is not a hobby. The second thing I should tell you about myself, without any false modesty, is that on one hand, I've got a lot of IT experience, and last 6+ years I've been spending a lot of time with customer-facing healthcare roles. So I'm able to talk about architecture and single sign-on and things like that with the IT people in the healthcare setting, and still in a blank go on to the healthcare businesses and talk with them about how AMA is coming out with CPT codes for medical tourism patients and things like that, and how what it means for them. It's not just about HIPAA compliance, but how it matches into their business needs. I've spent a lot of time over the last year, several months at a time, with some of the large insurance companies, kind of getting under the skin and understanding their pain points, and they are really, really eager, and that's what makes us special. And of course, we have got some values, and alignment of values is very important. The way our system works is essentially we get from the insurance companies or some other businesses information about the patient. We submit it. We get different responses to the diagnosis from different companies, different hospitals overseas, and connect back to the patient, doctor, and insurance company so that they can make an informed decision. The idea there is you don't want to have a decision of overseas medical treatment that's made just on cost. And that's something very important. And so our tagline is Medical Tourism 2.0 meets eBay. So to some extent, that gives you a flavor of what we do. The problem, you already know how US healthcare has a lot of basic problems in terms of cost. Treatment for any medical surgery, any major surgery or treatment can really bankrupt a lot of people, and it happens every day. Suddenly, with one treatment, you can go from being insured to underinsured or uninsured, and you have a huge implication for the long term. And so why now? And what we're saying here is that there's a demand because of as the boomer population is aging, and they will start having some of the health issues. And also there's an international supply of accredited hospitals that has reached a critical mass. But in addition to that, what we see is a major systemic change where we have seen manufacturing, and we have lived through that, how that got offshore, and now if we fast forward to 2010s, healthcare is something very precious and very dear to us. Now we're comfortable with the concept of outsourcing some of these things, and now we're willing to take it so the bottom line is we have seen this movie before, we know how it ends, and I think this is the time to engage with it. Now, medical travel, there's 30 countries around the world 3.0 that are really actively participating in a meaningful way in medical tourism. We know we are a small startup, we're self-funded, and we cannot do everything to everyone. So what we have done is we have kind of bracketed ourselves about what we can do, where our skills and our knowledge brings us. And that is where it's only for medically required procedures and only with internationally accredited hospitals. These are the ones where you have got some risk filters that have come in place and kind of established basic quality of service. At the same time, you have got medically required procedures, which means that there's other things that become possible. The thesis of all this is that there are good doctors, good physicians, good specialists everywhere in the world, and if we are able to do some prudent risk analysis, we are able to get a lot of cost advantages to your members, employees, and patients. So we went to the different countries and found out that there are some key participants, and among those we have selected first using accreditation as a factor, and then the second filter using what is meaningful for American US patients and where they go to get treatment. We have selected Costa Rica, Thailand, India, and Panama. Now that may change. Taiwan is coming on, there's many other places that are getting very active. But right now, these are, and again, within each country, there are good hospitals and bad hospitals, and there are accredited hospitals and non-accredited hospitals. So we have selected 12 hospitals from here. And here the important point is, when we build a system, what's meaningful, and it's, while we are focusing on the healthcare insurance companies to begin with, there are other businesses that are really, really crying out for that, as are also governmental agencies. And so what we do, and this is a little complex slide, but we basically provide some of these HIPAA controls and regulatory aspects, provide them, and get some of the feedback in a very meaningful way, and make that available. And we have got a platform that's set up that can work on different technologies, Microsoft, SAP, Adobe, and so on. The pricing model, we charge based on insurance companies who want to submit, and then for access to the treatment plans and the quotes that are responded to by the overseas hospitals. And our target price case is about $3,500 per patient, and some of the informal conversations with our customers, they said this is absolutely fine and not a problem. Our go-to-market strategy, again, there's a lot of things here. Catch me afterwards. We have got various things. We are primarily starting out with the insurance company, but there's, like the previous slide showed you, there's a lot of other companies and businesses that are really crying out for something, and we have built this after having deep, ongoing discussions with some of them. Sales projections, we are looking, if we believe the feedback we're getting, then we can easily meet or exceed these numbers very, very quickly. And this is a classical projection that we have. These are some of near-term milestones. We have got some activities going on right now, and then some of the long-term things that will come in play, and in terms of some of the things we don't know how things will shape out by 2012. So if there's anything you need to learn about this, it's everything's on this one slide, and that is about how the customers are asking for something like this, and we have been in touch with them, how the government is supportive, it doesn't matter who comes in the White House, the patients, consumers are demanding more choices, and we have a solid tech team, and as I mentioned, we're now looking for seed capital. A lot of Blue Cross Blue Shield, and we're in touch with all of them. They have already formed specific alliances with different hospitals, but they are not able to scale because of the.
So your model is to help those insurance companies find the right hospitals and the right doctors for those procedures.
That is correct.